name is Veronika Kim, and I am the founder of comprehensive women well-being ecosystem Balansize, designed to help women save time, reduce stress, start wellness journey at every stage of life. And today we are having very honest and supportive conversation about women health, fertility, and IVF treatment with Professor Dr. Luciano Nardo, consultant in gynecology and expert in reproductive medicine and infertility. And Dr. Manar Jabbar Hussein is a specialist at OBG and regenerative medicine, master in fertility UK, regenerative gynecology. Hello, doctors.
Hello.
Hi.
So we will talk about expectation, preparation, success rates, and pregnancy after IVF, and some of the most common questions women worry about it. And not just a medical side, but emotional journey many women and couples experience. So our goal today is to make fertility and IVF journey and pregnancy, of course, feel less overwhelming and more understanding. So, Dr. Luciano, many women start IVF thinking there is one standard treatment plan for everyone. But in reality, every woman's body and fertility journey is different. So, can you explain why there is no one size fit all approach when it comes to IVF treatment?
IVF is a journey and starts with detailed investigations and the medical history that we take from patients. We cannot ignore individual circumstances. We cannot ignore underlying medical conditions. We cannot put together all women coming to an IVF clinic assuming that they all start a similar process. So it has already been probably more than a decade since we have accepted that IVF is not one size fits all. We are at a stage where we are not even tailoring, but we are individualizing treatment based on patients' characteristics, clinical profiles, needs, and preferences. And of course, we need to bear in mind what is the result of investigations that we carry out on these women so that we can personalize their treatment.
And why should women avoid comparing their IVF treatment journey with somebody else?
There is no way that a single cycle for the same woman and between women is the same. The response to stimulation, the type of treatment, the patient's profile is different. So I always say to my patients every day, do not compare yourself to someone else. Do not even compare your treatment cycle today with the previous treatment cycle, because what we do is actually sometimes learning from a previous cycle in order to optimize a subsequent cycle. And for the patients that try to compare the treatment with that of their friends or family members, again, it's not possible as there are different patients' profiles.
So we can take it that the IVF is not really about formulating one formula. It's that about understanding what particular your body needs. Thank you. And what do some patients undergoing more than one IVF cycle before embryo transfer? This is something many women don't realize, that at first sometimes doctor recommend more than one IVF cycle before transferring an embryo.
We have moved away from a one cycle at a time approach to what is now considered a multi-cycle approach. We have the laboratory technologies to grow embryos, to freeze embryos, as well as to select embryos. So IVF is a numbers game. In most cases, more eggs and more embryos, we have better cumulative outcome we will have. So especially in women, in couples with reduced fertility potential, repeating the cycle and accumulating embryos may afford the opportunity to have ultimately a better outcome by having more embryos that can be selected and of course transferred into the uterus at a later date.
Great. And can you explain the different stage of the IVF in the simple terms and to women to understand easily?
IVF can be segmented into various steps. The first will be undergoing some investigations prior to starting treatment. The second is the ovarian stimulation. This is a fundamental part of the IVF process. Women naturally, physiologically, will be producing just one egg at a time. With IVF, we aim to stimulate the ovaries so that at the end of the stimulation process, we harvest as many eggs as we can. That will enable to fertilize the eggs. So the second part of the step, of the IVF step, is actually to stimulate the ovaries. The third one is to harvest the eggs. And after eggs are harvested by the physician, then the eggs, together with the sperm, will be in the lab going through the process of fertilization, embryo development, and after 5 days, once the embryos are created, then there is an option either to cryopreserve the embryos or to transfer back into the uterus. Also, with advances in the laboratory, now we're able to do genetic testing of these embryos. In some cases, we get the results within 24 hours. So even with genetic testing, we are able to transfer the embryo or embryos back into the uterus in the same cycle.
Yes, thank you so much for answering, Dr. Luciano. And it leads to my second question, that women often become very focused of the number of during the IVF for the embryo or the eggs. So is the number of available embryos important for the success?
Of course, the number of embryos, and prior to the number of embryos, the number of eggs, is central to the success. Today, with individualized protocols, with much more efficient and safe procedures in the lab, we are able to create more embryos. And of course, more embryos means we have more to choose from, more to select from, and we have a cumulative live birth that is higher, simply because embryos can be cryopreserved and used in multiple cycles. So I always say to patients, do not rush into embarking on a new IVF cycle. Maybe better actually to continue the stimulation, to accumulate embryos, to genetically test embryos, so that we can ultimately increase the chances of a successful live birth per transfer.
So what matters more, quantity or quality?
I think both of them is difficult to say whether quantity is better than quality or quality is better than quantity. Ideally, we want to have a good cohort of good quality eggs that can be fertilized and reaching a good cohort of good quality embryos that can be cryopreserved for future use. So it's a balance between quantity and quality. But the important factor is that not all women, not all couples have the luxury of having both quantity and quality. So in some cases, it is important to consider not just one cycle treatment, but multiple cycles in order to increase the quantity and then have the ability to select good quality embryos.
Great. And what can I actually, what most women, when they're going through this difficult journey, an emotional journey of the treatment, they always ask, what can I actually do to improve my chance? How to maximize the chances of positive IVF treatment?
The chances of a positive pregnancy outcome comes from a multiple approach. Of course, first is to be emotionally and physically ready to start treatment, to have adequate support, to have a healthy, balanced diet, and in some cases, actually, to find help elsewhere. And this is very important, as we know that the emotional impact of this journey can take a toll on some women, some couples. And as a result of emotional stress, there may be some hormonal imbalance caused by cortisol levels rising, progesterone levels dropping. So it is very important that every woman embarking this journey, apart from the general well-being and nutrition and vitamins and support that they can find themselves, in some cases they are actually open-minded in finding support elsewhere. Hence why it is very important to include in a comprehensive and holistic IVF approach also the help of counselors, of reflexologists, of acupuncturists, so to provide that general well-being that women may need during their journey.
Great. So it's again remind us, so the journey is not the perfections, it's just preparation, balance, and support truly matter during this journey. What about this managing expectation and emotional well-being? Do you have a kind of some of the program, or do you suggest your patient what they, apart that you said, if the acupuncture and everything, maybe a family support, how this affecting the treatment?
I think managing expectations is a very important part of the treatment. We know that 1 out of 3 couples embarking in this treatment, they may drop out because of lack of support, because of lack of realistic expectations. So adequate counseling and offering couples perfect support in the form of realistic expectations is very, very important from the beginning. And I've seen throughout my 20 plus years of work in this field that couples that are given the right information, couples that have realistic expectations and are counseled properly are more likely to continue treatment. And since IVF is not just one cycle, that means that if couples continue this journey, overall will have a better chance of success.
So it leads to my another question. How do couple or woman know when to stop IVF? This may be one of the hardest and most emotional questions for women face.
I think this is very difficult, and unfortunately, every day we have cases where patients come to clinic and they may have several failed cycles at their back. I think the time when to stop or to pause or to reconsider fertility treatment is crucial and comes from an educated discussion with the physician, comes after detailed analysis and review of the previous treatment cycles, comes with full knowledge of what else can be done. And in some cases, physicians, they have to advise couples actually not to continue because all the available avenues have been explored and there is nothing else. It is not just a matter of being resilient, but it's a matter of what is realistic. And it is certainly not after one failed cycle, it's not certainly after one failed embryo transfer, it is certainly not after one failed ovarian stimulation cycle that we advise patients to stop. I think we need to have information coming from overall analysis of the investigations of the treatment cycle outcomes, of the embryology report, before we can say actually we believe that this journey has now ended, because we don't have the knowledge or the resources to actually to help you anymore.
Great answer. And here I want to ask Dr. Manar for about the now let's move into question where many women have one pregnancy actually happens after IVF,
Yeah.
because the journey doesn't stop on the positive test. So, Dr. Manar, is perception care before IVF important for the pregnancy outcome?
For sure, 100%, absolutely. How to prepare the patient, how to support her, how to make her ready for this step is very important. So, and it can be started with a very few simple steps before conceiving, 3 to 6 months before starting IVF cycle, how to prepare your body, biological preparation, like to take folic acid if you have deficiency, to especially if you are struggling, let's say the patient with morbid obesity or diabetes, to take vitamin D, to control her BMI within the normal range, not to be less than 18.5, not to be more than 30, stopping and cessation for smoking and alcohol is very important. Reduce stress is very important. And if she is struggling with diabetes, so to do good control for blood sugar and thyroid function if she's struggling with hypo or hyperthyroidism.
Great. And how can women separate pressure from personal readiness? Because nowadays everybody going for the career-driven woman, and they a little bit delaying with the pregnancy and the childbirth.
Yeah.
And there is still our mothers, grandmothers when they're waiting for the grandchildren.
Yes.
So how the really can women separate this pressure?
I do believe that the support from the family is very important. And for the patient to understand that the IVF is a period or experience that, yes, maybe it will succeed, maybe not. So to understand it's not like the final step in your life. And even after failure, you can repeat it again and again. It's not something like just for one time. So family support and support from the doctor that you are dealing with is very important at this step.
Great. And there is often fear around IVF pregnancy and whatever they're automatically consider high risk.
Yes.
So is an IVF conceived pregnancy more at risk? Is that different from the natural pregnancy?
Yes, this is one of the misleading questions that I'm hearing from a lot of patients when they are coming to the clinic, that I'm an IVF patient, so I'm not supposed to do any activity, even I have to be all the time in my bed. This is wrong. IVF is not automatically high risk. We have to understand the reason why you are doing IVF. Are you struggling with endometriosis? The patient struggling with polycystic ovarian syndrome, but according to yesterday guidelines, they changed the name to polyendocrine metabolic ovarian disorder. So we have to understand the reason and after that to reevaluate the case.
How the woman can avoid unnecessary fear and anxiety about the pregnancy after IVF treatment?
See, the proper follow-up with your doctor is very important. So, to understand that the steps that you have to do after the IVF is important. Like, let's say, after 14 days from the embryo transfer, you have to do beta ECG to confirm a pregnancy, and after 48 hours to repeat. And if it's doubling, so it means that it's intrauterine healthy pregnancy. To do the ultrasound by week 6, 7, confirm fetal viability. By week 8 to 10, to repeat the ultrasound to observe the fetal growth and well-being. So these steps is very important. In addition to like observation, close observation with your doctor. So if your pregnancy is well observed and it's a low risk pregnancy, so we can consider it same like natural pregnancy.
Great,
Conceived.
great answer. So we avoid this myth about the
Yes,
difference between pregnancy of
definitely.
IVF and the natural. Great. And another question I would like perhaps also Dr. Luciano and Dr. Manar, if
Yeah.
you can answer. But years ago, twins after IVF were often celebrated as an ideal outcome for a
Mm.
woman. Yeah, you're pregnant one time and then you have two babies, and it was amazing, and it was really popular. I would guess women requested to do it. So I want to understand now the options are changed. Should women avoid twins or multiple pregnancy, or it's still individual?
Prof.
I,
Luciano.
I think there's been a significant shift worldwide from multiple embryos transfer to a single embryo transfer, simply because the chance of success of transferring multiple embryos at the same time are not significantly different than transferring a single embryo. But we know that transferring one embryo at a time will facilitate a healthier pregnancy, will lead to a higher chances of live birth, and will also enable the couple to preserve embryos for future use. So overall, I think best practice and professional guidelines suggest that transferring one embryo at a time is giving the couple a higher chance of a healthier pregnancy and also higher cumulative live birth rate, which means keeping embryos for future use.
Okay. And I'm sure that it's affecting of the pregnancy. Yes, Dr. Manar, if you would like
For
to
sure,
add.
because like twin pregnancy will increase risk during pregnancy, gestational hypertension, diabetes, preterm delivery, an increased rate of cesarean. So always we're advising single baby, single mother, one. That's it.
This is idyllically.
Yes.
And why do often the risk of the pregnancy between multiple pregnancy for the mother it's high riskly than the
As I explained earlier, it will increase risk for many diseases or factors during pregnancy. The risk for gestational hypertension will be double or triple. Gestational diabetes, preterm, abortion, miscarriages will increase. Abnormal placentation, placenta previa or whatever, abnormal presentation for the baby. So the rate for cesarean section will be higher. So that's why always we are more with single baby.
single baby.
Yeah.
But still, if the mother is insists to have a twins, so there is the certain condition to consider, correct?
We cannot guarantee that transferring two embryos will lead to twins.
Yes.
Because we can transfer two embryos and none of the embryos implant. We can transfer two embryos and only one of the two implants. We can also transfer two embryos and both implant, but then throughout the pregnancy, one may be a vanishing twin. We know that in some cases, not all multiple pregnancies will continue. So it is difficult to guarantee twins after IVF. Of course, in some cases, provided the prospective mother is in good general health, we can transfer two embryos. And obviously, providing that the couple accept the risk of multiple pregnancy and twins. But we cannot guarantee that they will have a twin pregnancy from the transfer of two embryos.
Great. And another very common asked question for doctors and then basically gynecologists is the mode of delivery affect if you conceive with IVF?
Yeah. I'm hearing this question a lot from a lot of my patients. That my doctor, she told me I'm IVF patient, so I have to deliver cesarean. This is wrong. IVF is not the indication for cesarean section delivery. You can deliver normally if your pregnancy is a low risk pregnancy, because we are not deciding according to IVF. We are deciding according to the baby condition, placenta, and maternal condition. So let's say if the mother, she has like gestational hypertension, uncontrolled diabetes, placenta previa, placenta accreta, any abnormal placentation, problem with the baby, like big size baby, small size, like any indication. So at that time, we will say that, okay, we'll go with cesarean. But like IVF with low risk pregnancy, no any indication for cesarean, no, she can deliver normally.
Understandable. So IVF itself doesn't define the birth
No,
experience,
definitely.
and every pregnancy's delivered path is individual and different.
Yes.
I have another question with regards to pregnancy after IVF. Most people they say they need a lot of support by medication that you might be again it's the myth, so that you might not need it while you're natural pregnant.
The medication support, the main time that we need to focus with the patient, and the patient like to do follow-up with her infertility doctor before shifting to us as OBG doctor, is the first trimester. So we need to give, in some cases, like progesterone support for the pregnancy at the beginning, but it's not like for all patients. I don't know if the Prof. Luciano will agree with me or not. So yes, Prof, if you want to
I think
comment.
the benefit of progesterone supplementation, the benefit of medication support because of IVF has got very limited evidence, and all patients are different. So there may be patients that have some underlying medical problems for which we recommend to take Clexane, but not because they've conceived through IVF, because they may have a history of thrombophilia. That could be a contributing factor to infertility as well as to miscarriage, and could raise complications in pregnancy. So IVF per se, unless there are some underlying medical reasons, doesn't warrant prolonged medication treatment post pregnancy establishment. However, in some patients, especially if they have conceived through IVF in a fresh cycle, because of the hypofunction of the hypothalamus and pituitary axis, so producing less natural hormones, they may require progesterone supplementation for the first 8 to 10 weeks of pregnancy. But generally, in this day and age where actually we tend to do more frozen embryo transfer in natural cycle, where patients have their own menstrual cycle, so produce their own estrogen and progesterone, there is certainly less requirement for medication support post IVF conceived pregnancies.
Great. And there is the age related success for the IVF. What would you recommend ideally age for the IVF treatment? And it comes to also to lead our another question that we discussed before, like when the woman needs to know that this is the time I need to stop and maybe look for the alternative path.
The age, usually we are saying that it depends on the factors. Is it like male factor, female factor, or like combined or unexplained infertility or whatever? Normally, the ovarian reserve will reduce after age 35. This is a fact. And the egg quality will be not same like before. So I think Dr. Luciano also will add more information from his prospective point of view, infertility point of view, regarding the exact age for when to start the IVF.
I think that we know that chronological age is the main determining factor to IVF success. And as women age, they will have less eggs and less good quality eggs. And of course, if women get pregnant at the age of 39, they will have a higher risk of pregnancy loss compared to women who get pregnant at the age of 32, simply because the availability of euploid, genetically normal embryos, decreases with advancing maternal age. So it is not age is not a contraindication to IVF. However, counseling patients that are chronologically older than 37 is very important, so to manage their expectations. And data that are widely published suggest that women under the age of 35 have around 30% of their IVF created embryos as being aneuploid, which means genetically abnormal. Whereas women over the age of 39, they may have up to 80% of their IVF created embryos as being aneuploid, so genetically abnormal. So age is an important factor when it comes to starting IVF. Is certainly not a contraindication, but age is part of the counseling that physicians need to undertake with the patient at the time of the appointment. But of course, the other side is that as women get older, they may face some complications in pregnancy. So preconception counseling is also important in terms of how they prepare for that pregnancy and what they can do to mitigate the risks that are associated with their chronological age.
And I would like to, it's on the out of curious to ask, what is the age of the eldest woman that you have a treatment of IVF? And for Dr. Manar, in the patient practice, what you have the highest age, I would say, the woman deliver the babies.
Yeah.
Actually, I have had patients coming to umbilical treatment using their own gametes, so own eggs and pattern sperm up to the age of 50. If they have regular cycles, if we can find follicles in the ovaries, of course they can be stimulated, but no one comes to a fertility clinic just to tick the box and say, I have had IVF. They want to have a baby. And I have not had any patients over the age of 36 that have achieved a successful live birth using their own eggs.
Yeah.
Okay. And for you, Dr. Manar?
For me, I cannot forget one patient. I was like junior maybe at that time. Her age, she came to deliver baby, her age was 55. And her daughter, she was with her to assist her, and the age for the daughter was 40. So
It's amazing.
yes, amazing. So this one also the amazing stories that happened during my experience. So as Dr. Professor Luciano, he said, for the age, we don't have like specific age to confirm, like to speak about it.
Great. And thank you so much. It was very helpful. And I hope that for the many women who will watch it, it will be really beneficial for them to learn about the treatments, to see what's wrong, what's right. There is a lot of myths. But in the end, I would like to have most common questions that come to your side, Dr. Luciana, and your Dr. Manar, for the patient that is like really in the regular base out of a lot of information around the internet and the world and from doctor. What is this most questions asked by patients from you?
For IVF,
For the pregnancy, for the IVF.
how to be pregnant with a boy. And the twins. And yesterday, one of my patients, she came to the clinic and she told me that, doctor, they are saying that there is injection. If I'll take it, I'll become pregnant with the twins. So I told, see, this is not right. Don't believe everything. She said, no, they're saying it on social media, TikTok. No, this is wrong. So yes, I do feel like from my clinical experience, like daily basis with patients, like gender selection for baby boy or girl, and twin is very important. This is one of the main questions.
Interesting.
I think the one that comes every day in my clinic is how can I improve my ovarian function? How can I improve my ovarian reserve? Because we know that the age of women having their first child is increasing. The age of women and men coming to a fertility clinic is also rising. So we have inevitably a population that is chronologically older today than perhaps we had 10 years ago. So in some cases, women are now able to understand that one of the limitations to a successful outcome is the chronological age and the related low ovarian function. So they ask the natural question, how can I improve my ovarian function? How can I improve the quality of my eggs? How can I get more eggs? How can I get more embryos? And there is no, there's no magic formula. And of course, keeping in good health, avoiding, alcohol intake, smoking, regular physical exercise are all very important. But we have some adjuvants, we have some therapeutic options in this day and age. And I always recommend my patients perhaps to consider taking supplements that are anti-inflammatories, that are anti-apoptotic, are anti-aging, because they may have a benefit on the ovarian function ultimately. So the use of coenzyme Q10, the use of NMN, also known as nicotinamide mononucleotide, I think is something they can consider, something I advise them to take. and also important that they have a balanced diet, and perhaps they also consider some intermittent fasting, because intermittent fasting has been shown to improve metabolism, to increase energy, and to reduce body inflammation. So this is probably the question I get asked by my patients every day in the clinic. How can I improve my chance of success? How can I improve my ovarian reserve? And it is sometimes difficult.
Yeah, as I see, as we say, it is a journey. Yeah, and journey start with your own well-being, own health, and the first. Yeah, it's like a wheel of balance that we said that you have to combine everything together: your fitness, your emotional statement, your nutrition, and also, of course, to consider the specialist and the doctor to prepare
Yeah.
for the treatment.
Yes.
Thank you so much for today. Thank you for your time. And it was really, really amazing conversation to know more about pregnancy, about IVF treatment. And I hope it helped a lot of women. Yeah, it's very interesting. Let's do this like this myth and truth. One, I have story. We went with one city, one country is different. Like we were traveling. So my son was a little bit not feeling well. So I took him to the doctor. And the doctor asked me a question. Is his IVF baby, like knowing my age and knowing his age, he was asking immediately if he is IVF baby. And this is surprised me. I was saying, why? What is the criteria? It's different if it was a normal, like conceived baby or this is IVF baby. So they said, no, we just would like to know, and then consideration maybe on the certain part. So I want to know, this is myth or true? Is the babies who is naturally conceived is different from the baby of IVF?
Yeah, if you look at the statistics from many public and available organizations, there are more than 15 million children born with IVF. And unless there is an underlying parental problem, then there's no evidence that children conceived through IVF are any different than children conceived naturally. However, we know that in cases of, for instance, severe male factor infertility, when we are going to offer IVF, we may actually increase the risk of abnormalities in children that are conceived through IVF. Because we are going to force the fertilization of eggs, probably with a sperm that is abnormal. Also, when couples have prolonged unexplained infertility, embark on IVF, it is very important to do some genetic studies, because one of the reasons, or perhaps in some cases multiple reasons, why they cannot achieve a pregnancy is because of some genetic problem. And inevitably using their own gametes, so their own eggs and sperm, that genetic problem can be passed on to their offspring. So per se, in healthy couples, IVF doesn't increase the risk of having abnormalities in the children. However, in some cases, when IVF is done because there are underlying parental problems, or in some cases where actually parents have not been fully investigated, then you may find that there is an increased risk of abnormalities.
Okay.
This is my opinion.
Great. And Dr. Manar, a question for you with regards the traditional medicine, and a lot of people when they go to this in traditional medicine, I would say outwardic. So some patient then before to get pregnancy, I don't know, they getting some herbs.
Yeah.
That some of them they're not believing in the like
Chemical medicines. So,
absolutely.
yeah.
So can you talk about that little bit?
See, as an Arab doctor and in the middle of Arab culture, yeah, I see a lot of patients that they prefer to use more the herbal things instead of chemical medicines. They don't have the belief that this is useful and no, it will hurt my body. And instead of it, I'll take this and that and that. for hormonal balancing, for menstruation regulation. But I, as a doctor, as a gynecologist, I cannot tell them that, yes, this is evidence proof and you can use it instead of a medicine, because I saw a lot of cases after taking, or a lot of patients after taking these herbal things, they came with a lot of complications, like for hormonal level, menstrual abnormality, heavy bleeding, intermenstrual bleeding. So Dr. Luciano also he will add, for me, I don't support completely this idea, like choosing herbs instead of medicines.
Absolutely, or at least you have to consult with your doctor to
Yes.
take any herbs before you want to start any treatment,
Yes.
specifically if you want to conceive the baby.
Yes, absolutely.
I believe that there is a place for complementary therapies, but this has to be dictated and has to be offered by physicians that have got that knowledge of complementary therapies, rather than patients finding themselves online or medicating themselves with non-conventional options just because they believe that is not harmful.
Yeah.
So if we are considering herbal medicine, if we are considering complementary therapies, or if we are considering traditional medicine, still behind that practice, we need to have physicians with knowledge and experience to advise at the very best patients. And patients should not be thinking, okay, I can take this non-conventional therapy or this herbal supplement because I know it's not going to be harmful.
Understand. And what would you recommend as a analysis or as a preparation before pregnancy and of course before IVF?
Before pregnancy and IVF, like how to prepare your body?
Yes.
So you have to keep yourself, like, as I said before, reduce stress, to do exercise, regular exercise. If you are struggling with obesity, to reduce your weight with a specialist in nutrition, to control your BMI within normal range. Vitamin D, folic acid, very, very important. And folic acid, I do prefer to give for my patients the active form, sorry, of folic acid, which is foliate. If the patient is struggling with uncontrolled diabetes, hypertension, abnormal thyroid function test, we have to investigate, we have to check everything. From my side, I do believe also the antioxidants like Q10, L-carnitine, in specific patients, that it will play a very important role. Like, it's how to prepare your body, biological preparation, before start with the IVF.
But how long it's taking? Like
3 to 6 months,
3
let's
to
say.
6 months.
Let's say, yeah.
Okay.
It's not a perfection period of time. It's like how just to give a time for your body to heal well before starting.
Absolutely.
If you are struggling with any of the conditions that I mentioned before.
Yeah, absolutely. But this is what, again, we come to that question about the expectation.
Yeah.
Because so many women, they're like thinking the time, we still have a lot of time, we have still a lot of time. Wait, I will do the career, I will travel, I will buy a house. And then the time is passing so fast.
Yeah.
And then when you want to start something, they want just immediately. So that was my question, that 1
Yes.
month, it will not enough to prepare your body
No.
perfectly.
Like cut for smoking, alcohol, this also, it will not happen by 1-2 nights for sure. And also another point that you mentioned, that a lot of patients coming to me in the clinic and asking for egg freezing. And this like, okay, I'm not ready now to conceive. I didn't find the perfect partner for me. So I want to do the egg freezing, and later maybe I'll think about conceiving. So this is another important point to mention.
Yeah, and how recommended for the egg freezing for the woman nowadays, with now fast-paced world, I would say?
I think egg freezing is certainly an option to preserve fertility. But women should not consider egg freezing just as a way to postpone childbirth. Because although we can freeze eggs, and the advances in the laboratory have allowed us to be very efficient and be also very effective with the cryopreservation of eggs. However, the number of eggs they should cryopreserve is not going to guarantee that they will have a successful pregnancy in the future. So egg freezing is readily available. It's not complicated. It's a process that takes about 12 to 15 days. And women can consider it, but not just a way to postpone pregnancy.
And what is the age, Dr. Luciano, for the egg freezing? What is the maximum age that the woman can freeze egg and it will be more successful than later?
Again, as for IVF, younger women have a better chance to have healthy eggs. They can start egg freezing at a later age as well, but they need to accept they may not have enough good quality eggs, and also the number of eggs per cycle may not be ideal. So they may consider having multiple cycles of egg freezing in order to accumulate a good cohort of eggs.
Interesting. Thank you so much.
Thank you.